Bismillahirrahmanirrahim. Today we are starting our lecture series regarding the endocrine system. It is our first lecture regarding the endocrine system. So today I have selected the topic of endocrine gland and endocrine tissue. Before we start our lecture regarding the endocrine gland and endocrine tissues, first of all you should be able to differentiate difference between exocrine gland and endocrine gland. The major difference is duct. The exocrine glands, they have duct, so they pour their secretion through that duct. While on the other hand, endocrine gland, which secrete their secretion through the blood, and if mostly they are hormones, so they travel through the blood and reach at the target tissue and perform their action. This is the main concept regarding the endocrine and exocrine. So one other aspect you should be aware regarding the endocrine, that they are the second most important system which control our homeostasis or our internal body conditions. So they are unable to perform their action without the nervous system, so they perform their action under the influence of nervous system. So in this diagram I have there is mentioned few endocrine glands in the your cranial region. In the brain we will see three glands: hypothalamus, pineal glands, and pituitary gland. While we reach at the neck region, we find two other glands, which are thyroid gland and parathyroid gland. On the upper side, on the superior side of kidney, we will find the adrenal gland, and on the stomach bed or behind the stomach we will find pancreas. Mostly our pancreas has exocrine nature, but a little bit around about 2% of the pancreas involved in the endocrine secretion. So mainly there are islet cells which involve the function of pancreas. On the lower side, in the pelvis region, in case of male they are testicles, while in the case of female they are ovaries, which perform the endocrine glands. So endocrine system, first of all, they regulate practically every day. Our human and animal body are regulated practically every day by our endocrine system. So they are collection of ductless glands which secrete the chemical message, which we call them hormones. So they secrete hormones and they maintain the homeostasis. The homeostasis is such a function which is performed by every system, because maintenance of internal condition is very important, but they control the long-term control. The neural nervous system will control them, our body, but for short time the long-term regulation are controlled by our endocrine system, but they work parallel with the nervous system, because they perform their action under the influence of nervous system. So the major difference between the nervous system and endocrine system: first of all, their secretion is neurotransmitter, while on the other hand secretion is hormones, which is chemical messenger. They are secreted by the endocrine gland or acini cells, while the neurotransmitter are secreted by axon ending or nerve ending. So they perform the muscle contraction, glandular secretion, but they are not directly involved in the function of long-term regulation. Their action is just for milliseconds. After there is degradation of neurotransmitter, but for action in seconds to minute to hours to days to month is performed by endocrine gland. So they are long lasting effect, while on the other hand they have short effect. So nervous system is for short regulation and endocrine is long lasting regulation. General function, growth hormone, we already discussed the growth hormone which are secreted by our anterior pituitary. So growth hormone, thyroxine, insulin, glucocorticoid and gonadal hormone. Maintenance of internal body environment, for example ADH, mineralocorticoid, PTH hormones. We already discussed regulation of energy balance, metabolism, which is regulated by insulin, glucagon, leptin, ghrelin. Ghrelin is also a hormones of GAT tract. So reproduction, species gonadal and pituitary hormone. These are some functions. Now come to our first list of hypothalamus, pituitary gland, pineal gland, thyroid glands, parathyroid glands, adrenal, pancreas, ovaries and testes. These are our main endocrine glands. Their primary function is to synthesize and secrete the hormones. Synthesize and secrete the hormones. They act on body messengers. So the hormone hormone transfer their information and instruction from one set of cell to another. So they to the distant cell, from one cell to a distant cell, but their action is specific. A hormone do not know where they have to perform, but the receptor is specific, which define their specificity of action in a special target cell. So the hormones only perform their action in a specific cell because a specific cell have specific receptor. So for example, the hormones of testosterone act in the testes, in ovaries for acid, insulin and glucagon. So their receptor are specific. Hormones are not specific. So where there is a receptor, they perform their action. The other endocrine organs, we have mentioned the kidney, their secretion erythropoietin, renin, heart is ANP, atrial natriuretic hormones, lungs PG and AC angiotensin converting enzyme. So GAT hormone, many GAT hormones which is discussed in the GAT module, they all are endocrine. Placenta is another tissue which secrete the many hormones which regulate the pregnancy. So pregnancy hormones are secreted by placenta. Renin-angiotensin mechanism is start when there is drop in blood pressure or drop in blood volume. Renin released by kidney. Angiotensinogen is released by our liver. What they do? They renin act on angiotensinogen, convert them into angiotensin 1 and ACE, angiotensin converting enzyme, by the lungs, and they convert the angiotensin 2 and angiotensin 2 act upon adrenal glands to stimulate the aldosterone. What is the function of aldosterone? To maintain sodium chloride and water balance in the renal tubule. So in this way, aldosterone act on the kidney to stimulate reabsorption of salt and water. So this is the mechanism of renin-angiotensin system. So coming back to our types of hormones, now another concept, all the hormones which we have discussed is mentioned, but now the type of hormone, there are mainly three types of hormones: steroid hormones, amines and peptides. Steroid hormones, they originate from cholesterol amines from uh, trypsin and peptide from amino acid or protein. So it's very important to know which hormones have which nature. The amine nature hormones uh, have don't, they are mnemonic to remember the amine hormones don't. Dopamine, adrenaline, noradrenaline, thyroxine. VAP, represent the peptide hormones. It is mnemonic for peptide hormone. V represent vasopressin, I represent insulin, P represent parathormone, C represent calcitonin, which is secreted by thyroid hormone, oxytocin, pituitary hormone, melanocyte releasing hormone. What is function of melanocyte? Skin color. And melanin and adrenocorticotropic hormones. These are peptide hormones. So another concept you must remember that the hypothalamus are and pituitary gland hormones are have peptide nature. Where is steroid hormone? In the AC, in the other hormone which is present in the peripheral organ, not in the brain. The brain is totally peptide nature hormone. Nearly all the steroid hormones are lipid synthesized from cholesterol. They are responsible for development of many male and female characteristics. As we have mentioned, the sex characteristic. Steroid hormone, for example, testosterone, estrogen. Testosterone and estrogen, they have steroid nature, so they maintain the sex character. Testosterone maintain the secondary male character in the male, while the estrogen maintains secondary sex character in the female. Amines hormones, they are derived from amino acid tyrosine. It's very important. Highlight this tyrosine 10 times in your books. It is very important. Secreted by thyroid. And the peptide hormone, thus each with only short chains of amino, they are synthesized largely as a protein. So they are derived from proteins, peptide from proteins, amines from tyrosine amino acid, and steroid from cholesterol, which maintain the sex characteristic. That is the main concept. So before I discuss these important glands, because the whole story of endocrine system is around these glands. You have to study their anatomy, their physiology, their hormone secretion, their action. So let's discuss the first concept we have already mentioned, glands. We have two types of glands, exocrine glands and endocrine glands. The major difference is duct. Exocrine glands have duct while they are ductless. You have studied a lot of exocrine glands in case of GAT module, in which we study the pancreas, saliva. They secrete their secretion through duct into oral cavity, pancreas into duodenum, but endocrine, they secrete their secretion into blood. So let's discuss the first endocrine gland which we have already mentioned. For example, the hypothalamus and pituitary gland and pineal gland. I try to draw this. This is your interior pituitary. This is your posterior pituitary. while on the upper side there is hypothalamus. They are present behind our in the base of skull. This pituitary, anterior pituitary and posterior pituitary. On the upper side there is hypothalamus. So this area which is infundibulum. Infundibulum is nothing but the it is a connecting stalk which connect the hypothalamus and anterior pituitary. So in this region we will find the arteries, veins and other nerves, so which connect the hypothalamus and anterior pituitary. So the hormone which are secreted by anterior pituitary, flat PG. It is a mnemonic to memorize the hormones of anterior pituitary. F represent the FSH, L represent the LH, luteinizing hormone, A represent the ACTH, T represent the ACTH, T represent the TSH, thyroid stimulating hormone, P represent prolactin, and G represent the growth hormone. The FSH, LH, ACTH, TSH, prolactin and GH growth hormone. These 6 hormones are secreted by our anterior pituitary. So while 2 other hormones which are secreted by our posterior pituitary are oxytocin and ADH or vasopressin. ADH or vasopressin, same name. So these are the hormones which are secreted by anterior pituitary and posterior pituitary. In your anatomy lecture you will better understand the difference between anterior pituitary and posterior. Posterior pituitary is not an actual gland, it is simply an extension of hypothalamus. So their secretion we call them neuroendocrine in nature. They are extension of hypothalamus, while anterior pituitary is a proper endocrine glands. So these secretion are also related to our hypothalamus. Hypothalamus is a controlling center, anterior pituitary is a controlling center, and the other name for anterior pituitary is master gland. This why they are called master gland, because all these hormone FSH, LH, ACTH, TSH, prolactin, GH, all these hormone act on the other glands which are in the other organs like ACTH, adrenal, and testosterone, oxytocin. All these hormones are secreted when they are stimulated by these anterior pituitary. For example, FSH, they act on follicle, luteinizing hormone, ACTH act on adrenal, TSH on thyroid gland, prolactin they are related to milk production, and GH growth hormone. So they are stimulating, they act upon other gland, they control the other gland secretion. So anterior pituitary is master gland, hypothalamus which control the anterior pituitary secretion. When hypothalamus gives signal to anterior pituitary, they secrete their secretion and which act on the other gland. So these are the anterior. What about the oxytocin and ADH? The oxytocin and ADH, you are better know that ADH related to renal tubule for the reabsorption of water and sodium. So that is the main concept regarding the ADH and vasopressin. Because vasopressin, vasoconstriction, they also act, and we will study their more concept in the discussion of anterior pituitary gland. So this is our first gland. Now move toward second gland. We have another gland which is present on near about the hypothalamus, which is pineal gland. Pineal gland. They secrete melatonin. Melatonin. What is the function of melatonin? Two main function regarding the pineal gland. First is the gonadal or sexual behavior, and other is pineal gland secretion is day and light, dark or light effect. So it is secreted in night time more, while on the daytime in the light its secretion down, while the hormones is melatonin simply inhibit the sexual hormones like testosterone or the other sexual character, male character, up till the age of adultness. For example, they have in age of 14 they become a adult, or age of 18. So before this age they are suppressed by the melatonin. So in this way they control the pineal gland, the action of gonadotropin hormones. Now look at the hypothalamus and pituitary. Look at it below the thalamus. You can see here is your thalamus and here is your hypothalamus, which is magnified in this section. This is thalamus, this is hypothalamus, infundibulum, and which form connecting the hypothalamus with interior pituitary and posterior pituitary. So the size of each gland is mainly a P-shaped size, but in this diagram we have magnified to understand the hormone. This is your infundibulum, which is pituitary stalk, and which connect the hypothalamus with the interior and posterior lobe. So the secretion of interior lobe are TSH, FSH, LH, ACTH, PRL, and GH, while the secretion of posterior lobe is ADH and oxytocin. Their function is to the hormones from these two glands crucial to pregnancy, birth, lactation, woman menstrual, including ovulation. We will discuss the hypothalamus and pituitary in a separate lecture, but here is a simple review. So growth hormone and anti-diuretic hormones, from growth hormone from anterior lobe, while on the anti-diuretic hormones which are secreted by anti-diuretic posterior secrete the anti-diuretic, while interior secrete the growth hormones. So anterior lobe growth hormone affect the growth of skeletal muscle, bones. This is function of growth hormone. Prolactin stimulate the milk production after the pregnancy. Gonadotropic hormone regulate the hormone activity of sex organ. Gonadotropic act on the ACTH and to secrete the testosterone and the estrogen, which define the sex characteristic. Also affect the adrenal cortex and thyroid hormones. These are the function. And posterior pituitary, two hormones, oxytocin help during the pregnancy. Anti-diuretic hormones inhibit the urine production if someone use the alcohol, which will inhibit the ADH, causing increased output of, so there is hyper urine secretion. So the function of vasopressin, two function. Oxytocin have also two function. The vasopressin function in the kidney, increase the permeability of distal and collecting tubules to water, while in case of arteries, vasoconstriction. So this is the function of the vasopressin. Two function in the kidney is to increase the permeability to water, increase the water channel, while in case of arteries, they vasoconstriction. Oxytocin to function in uterus and in mammary gland. In mammary gland, milk ejaculation, while in uterus contraction during the pregnancy. In this way, they help the uterus to deliver that baby. Let PG. To remember the name: FSH, follicle stimulating, LH, luteinizing hormone, ACTH, adrenal cortical hormones, TSH, thyroid stimulating hormones, so prolactin, GH hormone, growth hormones. Goat flap is a mnemonic for our pituitary gland. G represent the growth hormone, O represent oxytocin, A represent ADH, T represent TSH, L represent FSH, L represent luteinizing hormones, and A represent ACTH, and P represent prolactin. So these are the hormones which are secreted by our pituitary. Melatonin, pineal gland establish body day and night cycle. So melatonin and other function regulate the gonads. So 3 hormones we have discussed. Now move toward next glands, which is thyroid gland and parathyroid gland. This is our another gland, which is thyroid gland, present in our neck region. So 2 types of secretion regarding the thyroid gland is: first is T3 or T4, which regarding which function is to maintain the BMR, basal metabolic rate, So BMR, because they related to the metabolism, so they regulate the metabolism. For example, gluconeogenesis or other gluconeogenesis or proteolysis or lipolysis. So lot of mechanism of metabolism which are regulated by the T3 and T4. And other hormone which is secreted by the thyroid gland is calcitonin. What is the function of calcitonin? Calcitonin, I represent Ca, calcium. They deposit the calcium into the bones, from blood to the bones. Bones are it's not important that it deposit only calcium into bones. It may deposit into other tissue. The simple concept: they take calcium from the blood and deposit into tissue. So it's better to mention tissue. That is another concept, calcitonin. So this is about the thyroid gland. So now the parathyroid gland, they are simply lobes which are present on the peripheral region of thyroid. These represent parathyroid. What are they secrete the parathormone, PTH. PTH. Their function is opposite to the calcitonin, so we call them they are antagonists to calcitonin. What does it mean by this? Their function is deposit the calcium from tissue to the blood, from bones to the blood. So they deposit bones to tissue, blood. Bones are from tissue to. In this way they are also related to osteoclast, mean breakdown of breakdown of bones or weakness of bones. So if there is hypersecretion of PTH, parathyroid. So these are the hormones which are secreted by our thyroid and parathyroid glands. Thyroid gland, thyroid hormone T3 or T4, T3 and T4, which control the rate at which glucose is burned, or in other term we call them BMR, basal metabolic rate. They maintain the basal metabolic rate. So calcitonin decrease the calcium in the blood, while the para hormone increase the calcium level in the blood. So they decrease the calcium level in the bones. So these are parathyroid hormones. These are thyroid gland, which is present in front of your neck below the larynx, while the parathyroid hormones, which are lobes, which are four lobes mainly on the sides of or peripheral to the thyroid gland. These are four lobes which represent the parathyroid gland. So it is antagonistic to calcitonin. So they are functioning opposite. Calcitonin deposit the calcium in the blood, while the deposit the calcium from blood to the bones, while the parathyroid, which is tiny oval shaped gland, deposit the calcium into the blood and decrease the calcium level in the bones. So they help the osteoclast. Parathyroid hormone PTH increase the blood calcium and decrease phosphate in concentration. The calcium and phosphate, they are in opposite direction. If calcium level increases, the phosphate concentration decreases. So that is a mechanism. So in this diagram you can see that if the PTH decrease blood calcium stimulate the parathyroid hormone. If the calcium is decreased in blood, the PTH act upon the bones and pick up the calcium, bring back to the bloodstream. Act on the kidney and pick up the calcium and put it into bloodstream. Act on the intestine, take the calcium, put it into the blood. When there is enough calcium concentration, they are inhibited. So the parathyroid hormone is inhibited, so the deposition stop. So PTH hormone stimulate the bone resorption by osteoclast, which release the calcium into the blood. PTH hormone also influence the kidney to conserve calcium and cause increased absorption of calcium in the intestine. Now discuss the adrenal gland, which is present for example, this is your kidney. Over the kidney we will find the this is your adrenal gland or suprarenal gland, which have two parts. The outer is cortex, okay, cortex, and inner is medulla region. So as they have a difference in their structure, so they differ in their origin. One is from mesoderm origin and other one have endoderm origin. So this secretion, cortex is further divided into zones, which are three zones. Zona granulosa, fasciculata, And third one is the GFR, reticularis. GFR, you can remember the name GFR, three zones: granulosa, fasciculata, reticularis. So they granulosa, their secretion is mineralocorticoid. So they secrete the hormones which regulate the minerals, for example sodium and potassium and other hormones. And fasciculata, we call them glucocorticoid. So they regulate the glucose as represent, and other functions we will discuss in separate lecture. Reticular, they are androgen mean they are sex hormones. For example, testosterone is sex hormone. So this is a little bit discussion regarding the adrenal gland, or which have three zones: granulosa, fasciculata, reticularis. What about the medulla? Medulla secrete epinephrine and norepinephrine. Epinephrine and norepinephrine. So this is a little bit discussion regarding the medulla cortex. So we have discussed hypothalamus and the thyroid, parathyroid, adrenal, and this is your kidney. So and the in case of ovaries or testes, for example, if this is testes, they secrete testosterone. And if in case of female, there is an ovary, the both sides they have ovary. The ovaries secrete the estrogen and also progesterone, but the major difference is testosterone and estrogen. The testosterone, in the case of biosynthesis of testosterone and estrogen, first testosterone is made, then it converted into estrogen or female hormones. So this is testes and this is ovary. We haven't discussed the main glands which secrete the secretion in our body. Adrenal gland. So they have two parts: outer cortex, inner medulla release the hormone that regulate the mineral content. Adrenal medulla produce epinephrine and norepinephrine. So adrenal cortex mainly regulate the mineral content. They have mesoderm origin, they have endoderm origin. So zones: three zone: glomerulosa, mineral corticoid, fasciculosa, glucocorticoid, reticulosa, androgens. They are sex hormones. Ovaries and testes: female ovaries synthesize estrogen and progesterone in varying amount depending on where in her cycle a woman is. Testosterone is a principal androgen in case of male. So androgen sperm formation, development of male characteristics; estrogen development of female characteristics. Now let's discuss some tissue which secrete the secretion of hormones. So do you know our kidney also secrete the hormones, our heart is also secrete the hormones, our lung also secrete the hormone, our liver secrete also the hormone. This is a major concept. So let's discuss the hormones regarding the heart. If this is your heart, the atria of heart secrete the ANP, atrial natriuretic peptide, and BNP, brain natriuretic peptide. These are two hormones which are secreted by the heart. So our heart is also performing action of gland, endocrine gland. They secrete ANP, BNP. What is the action of ANP and BNP? They simply stimulate, they start the mechanism of RAAS, renin angiotensin aldosterone system. So they main function to sodium excretion. So they increase the sodium excretion through our urine. So this is function of the hormones of heart. Now the liver. What is function of liver? The main important function which are also performed by kidney, that is the renin, and other function is erythropoietin, and third is vitamin D production. These functions are also performed by kidney, but the erythropoietin can be secreted through our liver. Erythropoietin. So this is secretion of our liver. What is function of erythropoietin? That hormone is in the they are utilized in the mechanism of erythropoiesis, or the production of red blood cells. So this is your liver. What about the lungs? They also secrete hormone ACE, angiotensin converting hormone. It is the hormone which convert the angiotensin 1 into angiotensin 2, and they mainly regulate the mechanism angiotensin, renin angiotensin aldosterone system. It is utilized also in RAS mechanism. These are some kidney, liver, heart, lungs, and adipose tissue. Adipose tissue secrete the leptin. What is function of leptin? If you have you are aware of your gastrointestinal module, their function is to regulate the appetite. So this function of your leptin, which is secreted by adipose tissue. Adipose tissue secrete leptin. Target organ hypothalamus suppress the appetite. Heart, atrial natriuretic hormone, target organ is kidney, promote the excretion of sodium and water in the urine. Small intestine secreted and CCK, and kidney erythropoietin stimulate the red blood cell production, and liver somatomedin cartilage. So adipose tissue, heart, and the kidney erythropoietin. To other hormones, they are renin and vitamin D. They are also produced by kidney. For mnemonic to remember the hormones of kidney is red. R represent renin, E represent erythropoietin, D represent vitamin D. Liver somatomedin, which stimulate the cell division, and other hormones somatomedin by the liver. Somatomedin. Second, they act upon small intestine, stimulate the absorption of calcium ions. Stomach, gastrin stimulate acid secretion. Thymus, what is function of thymus? Thymus is also an endocrine gland. They are TH, mean they are related to the immunity. These are function of the glands. So we end this lecture. We have discussed the endocrine glands, endocrine tissue, and their hormones. So thank you for listening.